That's a staggering number.
It's a staggering number, and like they were saying, you keep hearing about it over and over again, and you keep hearing these numbers, but you also wonder about those COVID-19 tests, the at-home tests. They've become so popular.
Yeah, they're selling out quickly, but before you go out and grab one, we did some digging for you.
Our Andrew Christensen actually looked into these kits to see how effective they really are.
I swung by the CVS here on Ennis Jocelyn and also the one on Ayers to see if they had any at-home test kits. Unfortunately, they didn't, and employees at both locations tell me that they run out pretty quickly. So I decided to talk to a local doctor to see how you can make sure your test results are accurate. Dr. Kim Onufrak, the clinical director for the Corpus Christi Nueces County Public Health District, recommends taking the at-home version of the test twice. She says it's possible to get a false negative if you don't swab yourself correctly. If you got a negative test result but have COVID symptoms, she says tests done by professionals are more accurate because they are trained on how to perform the test correctly. Testing too soon for COVID-19 may also affect your results.
If you do have the signs and symptoms of COVID and your first test was negative, then I would still continue to quarantine and stay at home, because sometimes what most people will do is test too early.
Another concern voiced by Dr. Onufrak, most people don't report their positive result from an at-home COVID-19 test. She says if you do test positive, call your local health department for further guidance. You should still quarantine and test again. Public Health Director Annette Rodriguez tells me if you do test positive with an at-home testing kit, it is reflected in the COVID case numbers if you do report it to the Public Health District. Reporting in Corpus Christi, Andrew Christensen, KRIS 6 News.